Ketamine, what is it? It's a powerful anesthetic used on humans and animals. It's a promising and exciting antidepressant. It's an illegal recreational party drug. Ketamine is a chiral compound, meaning there is another molecule in reality or in potential that is of identical composition, but which is arranged in a non-superposable mirror image. S-ketamine produces anesthetic effects, while R-ketamine produces hallucinogenic effects. In 1962, ketamine was developed by chemistry professor Calvin Stevens. In 1964, ketamine was tested on U.S. prisoners. And in 1970, ketamine obtained FDA approval. Between 2002 and 2013, classification changed in various countries around the world due to increased illegal use. However, ketamine is on the World Health Organization's list of essential medicines. Ketamine suppresses breathing much less than most other available anesthetics, so it's an option for patients with chronic obstructive airway disease. However, due to possible hallucinations, it's not typically used as a primary anesthetic. It is the anesthetic of choice when reliable ventilation equipment is not available, such as emergency surgery in field conditions in war zones. Ketamine is used as an anesthetic for animals. It's the primary anesthetic agent used in equine surgery. Ketamine is an exciting and promising antidepressant. Given intravenously, ketamine might be the most important breakthrough in antidepressant treatment in decades. Most of the studies to date have tested ketamine in people for whom other treatments were not effective, including both medications and psychotherapy. This promises a new option for people with some of the most disabling and chronic forms of depression, whether classified as major depressive disorder or bipolar depression. The effects are equal to or greater than the other antidepressant medications and take place within 6 hours. The shift from 6 weeks to 6 hours has already transformed what could and should be expected of antidepressant treatments. Although lithium and clozapine have been reported to reduce suicide risk, until now there have not been medications that were specifically anti-suicidal. Ketamine lacks approval from the Food and Drug Administration for treating depression. In addition, it's expensive, it's not approved by insurance companies, and affects patients very differently. In 1978, John Lilly wrote The Scientist, a book documenting his isolation tank experiments with ketamine and LSD, which fueled popularity for the drug. Over the last few decades, recreational abuse of ketamine has increased, particularly in the club drug scene. The ketamine high only lasts an hour, but users say it feels like 2 or 3 times that long. It takes only 10 minutes to feel the effects. The drug produces a dissociative state, or a feeling of detachment. At higher doses, users experience what is called the K-hole, that consists of extreme disassociation and visual and auditory hallucinations. One user described it as flat out the most interesting and spiritual drug I have ever tried. You can attain the most profound states you can and cannot imagine. You feel connected to the universe and consciousness, at one with everything. You feel that you have the ability to imagine the outcome of future events with intense detail. It's as if one's eternal self is brought to the forefront of consciousness so it can look objectively down on the flesh self. Ketamine's effects are very different than other clubbing drugs, such as MDMA, since users are quiet and can have difficulty moving. The use of ketamine as part of a post-clubbing experience has also been documented. Death under the influence of ketamine would be due to environmental conditions such as drowning and car accidents, not the drug itself. In addition to its ability to cause confusion and amnesia, ketamine can leave non-educated or forced users vulnerable to date rape due to the associated confusion and amnesia. Ketamine bladder syndrome is a newly discovered consequence of long-term use. Ketamine damages the bladder, causing ulcers as well as fibrosis, which is a stiffening of the bladder walls. Symptoms include pelvic pain, blood in the urine, and needing to urinate hundreds of times a day. The phrase, "you'll be sadder without your bladder," has become known amongst ketamine users. As with LSD and other hallucinogens, the effects of taking ketamine are influenced by the user's mood and environment. A ketamine trip can be an enlightening experience for some and a terrifying nightmare for others. The majority of users are young. As many as 75% of ketamine users are aged 12 to 25. According to a 2013 Global Drug Survey, over 50% of clubbers in the UK reported having tried ketamine. Singles are 6 times more likely to use than married persons. The survey also revealed that ketamine was the most reported substance to abuse negative psychological effects among clubbers and was second after alcohol for physically negative effects. Ketamine is generally considered to be more psychologically addicting, but its physical hold on the individual ketamine addict can also be incredibly powerful. It's not uncommon to hear of ketamine addicts who take it several times daily, and regular abusers may find it extremely difficult to stop. The disassociation from one's consciousness an abuser experiences can be seductive. Regular ketamine abuse will lead to a rapid growth in tolerance, and tolerance can develop over days, weeks, or even months.
Chris goes straight for the vein.
At the peak of my K use, I was probably using between 5 to 7 grams personally a day, which could work out to like maybe 40 or 50 like shots or like injections per day. You're basically like zombified like a vegetable for large periods of time.
Years of excessive use has led Chris to develop a high tolerance to K.
Yeah, I did one shot and I got a rush, but it didn't really K hole from it. Like I didn't get the whole K experience.
Even when a user is catatonic, it's very rare to die from a ketamine overdose.
It's a really ugly thing for people to look at, but you're personally in the total state of bliss and like happiness. But when other people see you, you're like drooling on yourself and like can't stand up and like being all weird and stuff.
Still searching for the K-hole, Chris prepares to shoot up again.
So I put a little bit more K and a little bit more water.
This injection is finally enough, and Chris slips into oblivion. the user's mind cuts off from the external world.
Ketamine is an unpredictable drug that induces an array of symptoms in its users. Withdrawal symptoms usually last 4 to 6 days and can include cravings for ketamine, loss of appetite, tiredness, chills, sweating, restlessness, tremors, nightmares, anxiety, depression, and irregular and rapid heartbeat. In addition to bladder syndrome and increased tolerance, other long-term effects include headaches, flashbacks, poor sense of smell from snorting, mood and personality changes, depression, poor memory, thinking, and concentration, and abdominal pain. There is no medical intervention that has been devised to help people who abuse the drug, and residential treatment is generally not required. Therapy is important in order to determine why the individual is taking the drug and what void they're trying to fill by using the substance. Individual as well as group counseling and family counseling is recommended. The harm reduction model is recommended, which is based on the idea that reduction of harm to self and the community are the primary goals, without any judgments. This model, in conjunction with cognitive behavioral therapy techniques, provides the user with living skills including healthcare, nutrition, psychoeducation, communication skills with friends and family, and more. Users learn to become aware of behavior and trying to change it by avoiding triggers. Harm reduction is based upon person-centered therapy principles of unconditional regard and the client being an equal and therapy being collaborative and non-confrontational. However, there are psychodynamic principles where nonverbal cues and talking about the past are used to determine the possible cause of the addiction. Art therapy can provide users with a means to express feelings that they have previously been unable to communicate, and can also provide the art therapist with clues to underlying issues and a means to ask open-ended questions. These open-ended questions are part of motivational interviewing. Based on responses, the therapist looks for positives and strengths for the clients, and responses are reflected back and summarized. The first goal of therapy is to establish a trusting and mutually respectful relationship and avoid rapid assessments or labels. The second is an ongoing process of seeking and maintaining direction. The third is change talk, which is speech that favors movement in the direction of change and includes reasons and benefits for change, as well as how to make those changes and the discussion of first steps. The last is planning, which consists of a specific plan that the client agrees to and is willing to implement. Meditation and producing art can provide ketamine abusers with a new means to be present and feel connected to the universe. Repetitive motions of many art forms, along with the quiet solitude in which a person can surround themselves, can help clients reach a meditative and disassociated state. The calm mental and emotional state produced when creating art works to reduce stress, depression, and anxiety. Art directives can include draw the problem, then draw what it would look like if the problem were gone. Another is road to recovery, where significant events from birth to present day are shown with the question, how did I get here? This is reflected with compassion. When did the substance abuse begin? Why? Another drawing can be added to indicate what's next. This process should be small and manageable and should only be done once the client-therapist relationship has been established. Ketamine is of great benefit to society as an anesthetic, analgesic, and promising antidepressant for people with crippling depression. As a recreational drug, it can provide some people with the most amazing experience of their lives, but for others the worst. And it can be very psychologically addicting. Regardless of how it's used, ketamine can affect people very differently, and therefore caution is required.